It's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Well, hello and welcome to Boomer Life here on CIL 650. Starting things off musically to the, little Kylie Minogue goes a long way with this group of guests, I'll tell you. We're going to talk to the people from NeuroKinetics. Back with us on CIL 650. Dr. Philippe Silvestre, J.C. Gordon, and Sonia Dale are back in studio with us. And Sonia really likes that Kylie Minogue stuff.
I do.
Welcome back. Nice to see you all.
Thank you. Nice to be here again.
Philippe, good to see you too.
Happy to be here.
And J.C., good to have you back on side with us again today.
Always a pleasure.
Tell us about NeuroKinetics. You're the Director of Liaison and Logistics at NeuroKinetics. You're the one of the more recent members to the team. Tell us about the organization and what drew you to them.
Well, NeuroKinetics is all about optimizing the brain. What Dr. Silvestre has been able to find over the years is that when problems persist, there's an underlying cause, and that underlying cause has been the fact that the brain hasn't been able to be optimized.
Okay.
And so what NeuroKinetics does is measures the dysfunction and reverses it and changes it so that it becomes functional.
Okay, so this whole phrase, brain optimization, keeps coming up in our conversations. What exactly, Dr. Philippe, does brain optimization mean?
Well, several things. Usually it is a sequence of actions in restoring functionality in a brain which has been disabled.
Okay.
The first thing is to ensure there is no damage that could prevent permanently the recovery.
So an assessment is first and foremost.
An assessment is primordial.
Okay. So brain optimization then means being what JC was just talking about then, finding out where the deficiency occurs and restoring the brain to its original functional capabilities.
Or sometimes even better than it was before trauma.
Interesting stuff. Sonia Dale, nice to have you back with us.
Thank you.
I'm glad
Pleasure to be here.
I'm glad you appreciate the music. Sonia is the clinic manager and very frequently the first person that you'll call when you check into NeuroKinetics. So given that you speak to or respond to emails from people who approach NeuroKinetics for the first time, tell us a little bit about NeuroKinetics and what you do and why so many people seek you out.
Short answer would be it's a last resort for many people out there. That being said, is they've tried many other things, many other doctors, many other specialists, and then lo and behold, they do come to us, being that they're at their wits' end. Mm-hmm. So usually is when they do come to us, either they've done their research online on Google or any other website kind of a thing through us and checked and seen what is NeuroKinetics all about? What are they able to do for us? Majority of our patients are also referred into us from former patients, existing patients. They come in to see us mainly because they want to know what we can do for them.
Right.
They give me a call. What can you do for us? We're there to listen to them. Consultation is set up with them. Step by step, everything is dealt with at that point within the half hour, 45 minutes, listening to what their condition is.
Right.
Excuse me, what their symptoms are, and everything's discussed at that point with them openly.
Okay, now, JC, Sonia says that in many cases, NeuroKinetics is a destination of last resort, which suggests that in many cases, patients who see you now have been around the circuit, so to speak, and have had to try to describe their symptoms to other professionals with limited success.
That is absolutely so true, Sterling. I have had so many conversations with people who have called us as a last resort with very little hope.
Right.
Simply because of the fact that everything else that they have done, everything else that they have tried hasn't worked. And many times these people have been put in the management stage of the medical cycle, which is medicating them to death simply because they haven't been able to get an answer as to how to overcome their problems.
So they've gone to a doctor and described at length perhaps a traumatic event, an accident or something that caused them to be in pain. And here's the nature of my pain. And the doctor attending at the moment says, well, I've got something for that, writes them a prescription. This should manage your symptoms and sends them off. And that's the end of it. That's about as far as that particular professional wants to go.
Well, and that is where we get the phone calls from people at that stage. I just recently had a phone call from a lady who was a teacher, and she had a car accident, and she had a concussion. She was suffering from post-traumatic concussion symptoms now for 2 years, and she had a young family. She had a husband who was working and hadn't been able to get any help whatsoever with her symptoms. And she had been told, this is how you're going to have to be the rest of your life. And I had a call with her, and a lot of times when I speak with people, it gets emotional.
I'm
because
sure it does.
For the first time they're hearing that, hey, I might be able to be helped here.
Right.
Yes.
And as Sonia was saying, we are a clinic of last resort. We are a destination clinic because we get so many referrals from people all over the world.
Sure.
Either from former patients or Philippe's connections with NASA. We get a lot of referrals through the space organization as well, simply because of the brain optimization that Dr. Philippe has been able to pioneer. And the results are just phenomenal.
Well, I'm glad you opened that door, because Philippe is far too modest and would never do this himself. So now, thank you for doing that. Our other guest from NeuroKinetics is Dr. Philippe Souvestre, who in September, in just over a month or so, will go to Oxford University in England and be appointed a member of the International Academy of Aerospace Medicine. Congratulations to you, Philippe. That's an extremely prestigious appointment.
Yes, it is.
So talk to us a little bit about these people who come to your clinic, who come to NeuroKinetics, who have been told, as JC just described, well, it's unfortunate that you had that event in your life that caused you damage and trauma, but unfortunately, it's most likely that you're just going to have to live with the consequences of that event for the rest of your earthly days. That's about all we can do for you. So just adjust yourself accordingly. Have a nice day. And that's it. People get told, well, I'm afraid that, well, that's all we can do for you. And they almost smile when they say that. And you know that that's just not true. And that's why people end up at NeuroKinetics, in many cases, as JC has said, pretty emotional and more than a little frustrated.
Yes, indeed.
So talk to us about what you do with these people when they come to you. At literally, as both Sonia and JC have said, literally at their wits' end. They're just beyond frustrated, and mostly, in many cases, too many drugs that aren't particularly helpful, and too few sympathetic ears to listen to their story. Clearly, that's remedy number one for you. Take the time to listen. And after that, what do you do?
Well, once we have listened to them, there is a bond who appears and trust rises. Most of patients live in fear after having seen hosts and hordes of practitioners who were supposed to help them and came up with everything but help.
Right. Well, that would make a person afraid after a while. Maybe, JC, if somebody says to me, well, gosh, that's too bad, Sterling, that you had that event, but, you're just going to have to suck it up and live with it for the rest of your life. That's going to make me a little nervous about the quality of the rest of my life and about how vulnerable I might be to other incidents coming up. So there's no reassurance there at all, is there?
There really isn't. And as I mentioned, Sterling, a lot of times people talk to us initially, and they're very, very skeptical as to what we can do.
Right.
That why is it that you guys can do it and I haven't been told this before, type thing.
Right.
And that's why we are a private clinic, quite frankly, because when we work with our patients, it's not like a patient is going into a normal clinical medical setting where they only have 5 minutes or 6 or 8 minutes with a particular practitioner. We spend hours at a time with our patients to go over their history, to determine if we are going to be able to help them. And then when it does come to treatments, Dr. Philippe is spending up to 2 hours at a time with each patient to move them through their needs.
And I suppose, Sonia, that frustration that JC was just talking about, you hear it first.
I do.
And a lot, and the skepticism as well. Listen,
Yes.
I've called more than a few clinics in my time,
Yes.
and I haven't been very satisfied, and I'm tired of getting the runaround in that, and I'm expecting more of it from you.
Yes.
And you surprise them because you don't give them the runaround.
No, we don't. And they do have a valid reason. I mean, if you've been around the block, as you want to call it, they've been to many different doctors, many different specialists, and you've only heard one, one statement is the fact that it'll go away in time. You're pretty much dealing with it for the rest of your life.
Sure.
Or you got to take these meds for the rest of your life or for X number of years. And you finally come to a clinic or a resort, as you want to call it, and they're saying that there is hope. I do understand their reasoning, and I do understand the emotions behind it. But we explain to them the process. We explain to them the time that Dr. Philippe puts in, our team puts in, and things can change. I mean, those symptoms can go away. The condition can eventually, in the amount of time that we're going to work with them, will eventually go away. Yeah.
Dr. Philippe, JC mentioned the word concussion a few minutes ago, and we hear that word all the time. And yet, concussion is another fancy word for brain injury, is it not?
It is a modality. It is a modality of brain trauma.
Yes.
Brain injury implies we have a damage that has occurred anatomically. So I stay away from injury. I prefer the word trauma, which is more neutral and more encompassing of either without damage or with damage.
I'm trying to figure out or trying to ascertain what sort of person would be an ideal candidate for NeuroKinetics. And we're going to talk a little bit on the program today about accidents and injuries, whether it occur at home, falling down the stairs, or a workplace injury, and some of those can be pretty severe, or sports or whatever. Do people who come to NeuroKinetics, Philippe, have they been typically injured and they're still trying to recover from a fairly traumatic injury?
Yes, and that would be the common denominator of all our patients, whether from an acute situation, recent accident, or long time ago occurrences. Incapacitation is the master word. Incapacitation reflects the lack of performance that has built up, that has occurred, that has grown after a given event or particular event.
So by incapacitation, for example, if someone is injured in the workplace, for example, and is incapable of going to work, that's incapacitation. The person can no longer earn a living. But beyond that, there's a psychological incapacitation, because once you're out of the workplace, you're no longer, you lose a certain credibility in society. There's a social thing that goes on here too.
We call that disconnect.
Okay.
It's a disconnect with everything that is fostering in us the best side of things, including aspirations, ideal, vision, feeling on a mission, feeling able or being enabled by whatever support system available to perform what we are meant or feel called to perform.
Right.
So fear takes place in that case after a little while. It doesn't take long to feel that increasing uncertainty, and everything becomes out of reach gradually.
And then that fear can very quickly morph into anxiety and other more serious conditions, can't it?
Panic attacks.
Yes.
Yeah.
Sterling, there are levels of incapacitation. Just like going up the stairs, you go up one step at a time.
Mm-hmm.
We just had a gentleman come to see us, a young gentleman who was riding a bike, and a car turned right in front of him, and he ran into the car
and went flying over the handlebars.
Flying over, and he came in to see us about 10 days after that. He was not totally incapacitated, but he knew that he was incapacitated simply because he wasn't as sharp as he was. He's an engineer.
Okay.
He wasn't as sharp as he used to be before the accident at his work, on a computer, in talking, in speech, in memory, in that. So there are different levels of incapacitation, and it's literally like climbing the stairs.
And this fellow was smart enough to see that early on that he had lost his edge.
Exactly.
And that's for a professional. I mean, it doesn't take much to recognize that, but at least after recognize it, he picked up the phone and got busy, didn't he?
Absolutely, and that was more of a shorter term fix for us. But there are different levels of incapacitation, and if they're not dealt with at the earlier stages, they are going to say, as you say, morph into step 2, step 3, step 4, etc.
Which has to be explained in terms of complexity.
Right, right. So, and in many cases, as Sonia has already pointed out, Philippe, clients, patients come to you, and they've seen a lot. They've been exposed to a lot of different medical opinions and possibly even different therapies, none of which have worked because there they are at your clinic. So you recognize that these people have seen quite a number of medical people already. So are they skeptical when they see you, or are they just so tired of being sick and tired they're ready for anything?
You see both. Those you just described both ends of the spectrum.
Okay.
That's right. That's right.
Okay, we'll take a quick break here. When we come back, as part of our program today, we are very fortunate to have not one, but 2 patients from NeuroKinetics who are going to jump in on the program, talk a little bit about their experience with Dr. Philippe and the team at, by the way, NeuroKinetics, I should tell you where they are in Vancouver. They're in the Highcroft Medical Building right there on Granville and 16th at 3195 Granville Street. They're online at neurokinetics.com, and we'll talk to some patients and more with our guests when we continue on Boomer Life on Sea Isle.
Celebrating the baby boomer lifestyle. This is Boomer Life on Sea Isle 650. This is Boomer Life on Sea Isle 650.
You were always on my mind. You were always on my mind.
Lots of appreciation for the music here on the program this morning. Our producer, Dwayne Bishop, right on the money with the tunes this morning. On my mind, we're talking with the folks from NeuroKinetics. Dr. Philippe Silvestre, Sonia Dale, and J.C. Gordon are here from the NeuroKinetics team down there in the Highcroft building at Granville and 16th. And we're joined on the line right now by Brian from the Fraser Valley. Brian is with us. Brian is a former patient and is here to talk a little bit about his experiences with NeuroKinetics. Brian, thank you for joining us. Hello.
Hello there.
Good of you to take the time to be with us today, Brian. Tell us a little bit about the background of your story and how you came to NeuroKinetics, and how long ago was it?
The first that I can recall is I was trying to help myself because I just couldn't seem to get anywhere with the Western doctors and the Western medicine that they were prescribing.
Okay.
For what they perceived as could only be treated through psychotropic medications. So I was very turned off with that because of the awful side effects that you get when you are suffering from depression, when you're suffering from high blood pressure, when you're suffering from balance and speech, neurological types of symptoms.
Right. Now, what happened that brought all of this on in the first place, Brian? I guess I need you to back us up to square one and the event that caused these symptoms that you've just described to us. Was it an accident?
Oh, yes. August 26, 1987, I fell approximately 90 feet off a rock bluff north of Terrace, BC, working as a high scaler, and I really, even statistically, you should be dead when you fall that far.
Well, I was just going to say, a 90-foot fall on a rock face. My gosh, we're all lucky to have you with us today, Brian. That's a pretty serious event.
It is, but the good side is I got to see things up there. We're looking down at the Skeena River, beautiful salmon runs going by. It was quite a spectacular experience to have as a 26-year-old, to bring along your wife and kids in a travel trailer and do some traveling with the family while you're working. It was that side of life was pretty good.
All right. Now, how long did it take you between the time you experienced this very tragic fall and serious accident? You clearly had been, you were talking about psychotropic medications. Clearly, it was a workplace accident, so I'm sure that there were doctors and there was a protocol followed for people in BC with workplace accidents. How did that go for you, Brian?
Oh, that was kind of like an Alice Cooper song, Welcome to My Nightmare.
Okay. Not successful, then, to say the very least.
No, it was. It started off with consistent medical mismanagement behavior from case managers of workers' compensation boards.
Okay. And that's a very poor beginning. So clearly, with that as the setup, it didn't go very well for you. How many years, Brian, before you sought out NeuroKinetics and Dr. Sylvestre?
I was very fortunate to stumble across a retired radiologist. I won't give his name because I don't know if that's important or not.
Not a problem.
If you want it, I'll give it to you.
No, it's okay.
But he suggested after he was selling a product called Hyperimmune 8 powder, and he really thought it would help me. But he also, being a doctor and knowing way more than I would ever know in medicine, said, you really do need to go and see Dr. Sylvestre. He's a neurophysiologist, and I believe he can help you. And so I just, truthfully, I just got lucky.
Right. And when you went in and you had that first appointment with Dr. Philippe, and you found a sympathetic person willing to take the time to listen to your story, was that one of the few people that you had encountered with that disposition?
He was the only person that seemed to have an expertise in the field of neurophysiology.
Okay.
And it wasn't just sympathy at all. He's brilliant. I mean, I was in love the first day I walked in that office, and you know, when you get interviewed for 4.5 hours to properly diagnose the condition of your, because mine was complicated.
Sure.
And I had been misdiagnosed with dementia. I mean, I don't know what you think about diagnosis like that, but I'm an ex-4-time Golden Gloves boxer, and I quit my boxing at 19 years old, so I got married. I wanted to be a working person, and to be so badly diagnosed,
right,
was really hard to live with.
I suppose the fact that you had a 4.5-hour meeting with the doctor would have really gone a long way, because we've talked about, Brian, in the previous segment before you joined us here, we talked about how when people become injured, fear comes into play very quickly. They start to worry about themselves and their health and their ability to work and provide for their family, and other fears come into play, and pretty soon it starts to create a spiral effect that's not in the least bit pleasant, and I'm sure you went through all of that.
That's exactly right. The thing is you know, I don't think the average person truly can say they know what's going on with their neurological and physiological symptoms that they suffer from.
I agree.
And you need help from professionals, and if you're not trained in those fields of hardcore neurophysiology, you're gonna miss it.
Sure. So all these years later, Brian, you are a successful client at NeuroKinetics. Do you maintain a relationship to this day with Dr. Philippe? Do you, from time to time, go back for a, shall we say, and I'm a layman here, so I get to use this expression, for a tune-up, if you know what I mean?
Oh, exactly, and not only a tune-up. I mean, the whole office is so supportive that it's like walking into such a welcoming, warm group of people that aren't only educated, but they actually want to help you to the point where, especially where they've already proven in the past, NeuroKinetics gave me health for a year and a half that I didn't have for over a decade.
Wow.
And we're talking about things like hypertension, balance disorder, sleeping disorder, speech, like I couldn't even speak properly.
Right.
Clenching of the teeth so bad that I was breaking teeth in my mouth.
Wow.
The kind of symptoms that I'm suffering from still today, and that's all about to change.
Right. And it's all, and you've learned through Dr. Silvestre and the rest of the team how to manage. It sounds, Brian, like you're at least information is power, knowledge is power, and it sounds like you understand what's going on, and that makes it already so much more easy to deal with. Correct?
Oh yes, but unfortunately, this is a good day for me. But my good day, I'm 53 years old.
Uh-huh.
I'm sitting in my basement suite. I don't work for a living, but I'm not having all of these horrible things happen on my bad days.
Right.
That, for example, I sometimes forget where I even live. I mean, that's pretty bad at my age, forgetting how to get places. And if I didn't have modern technology like a new vehicle with satellite GPS, I wouldn't go out at all.
Right, right. Well, it's very kind of you to take the time to be with us today and describe your relationship with the team at NeuroKinetics. Brian, it sounds like they've been a great help in keeping you on track. Did JC?
They're my heroes.
All good news, Brian. Thanks very much for being with us today. We appreciate your taking the time to jump in with us on Boomer Life here on the radio.
Well, thank you for having me.
It's our pleasure entirely. Dr. Philippe, Brian talked about something there that I wanted to pursue with you, because when he came to you, having had numerous exposures and experiences to all sorts of medical possibilities, he described your ability to integrate Western and Eastern medicine as being the solution that he needed in his life. Tell us what he means by the integration of Western and Eastern medicine.
Yes, I have been privileged to be trained in both Western medicine and Oriental medicine, and I began my career having that double baggage, and that was a gift and proved to become a very, very great, efficient way to approach complex conditions like that.
Okay.
And it happens that combining both bring everything to the next level in about understanding and about having the proper means to restore dysfunctional conditions like this.
So is it possible that Western medicine, and you were a surgeon in the French Air Force, for crying out loud, you're a traditional Western-based doctor in your background, and so Western medicine is very much symptom-oriented, and Eastern medicine is very much holistic or big picture. When you combine the two, it seems that we have a rather effective approach, wouldn't it?
Yes, it is comparable to apply a prism on a light beam. You begin to see all the components of this white light into different colorful sub-areas. And that would be a good way to compare what combining Western medicine and Oriental medicine lead one to approach this type of condition.
Now, Brian brought up a very interesting scenario, and I don't imagine this is rare, but here's a man who described his accident. My gosh, he fell 90 feet, JC, for crying out loud, on a rock face. So, this is major league accident.
Yeah, he is a walking miracle.
No kidding.
There's no doubt about that. And he had been through the grinder for about 14, 15 years before he was referred by the radiologist to Dr. Philippe. And Dr. Philippe was able to, we were talking 2001, 2002, Dr. Philippe was able to work with him doing what we do at NeuroKinetics, which is optimizing the brain. And after that, he had a year and a half of his old life back.
Right.
And Brian will be coming back to see us very shortly, again to get another tune-up. But because of the severity of a 90-foot fall,
no kidding,
that is an extreme accident.
Yes.
And his circumstances were extreme. But that's the type of thing that we are able to work with and help at NeuroKinetics by optimizing the brain.
Right.
And when the brain is optimized and the dysfunction is eliminated and functionality is back working in the brain, symptoms are overcome.
Right. And the fear factor, it keeps coming up in the conversation, and it's very scary. Being sick is scary. Period, let alone being gravely injured and being doubtful about your future and your well-being. That's beyond scary. That's freaky. So, Dr. Philippe, when people come to see you, in many cases, the fear is paramount. That's the dominant emotion, isn't it?
It is. It is always there.
And so how do you persuade or convince someone to be less afraid and to put themselves in your hands?
You know, I am a mountain boy, and I remember when I was going up to tackle a few summits, I have learned that the best pool of people to make it for all has to follow the weaker link pace. That's what I apply in medicine. I am placing myself in the boots of my patient and walk at their pace.
Right.
I will not, as I cannot afford to assume that they will be able to walk at my pace. Right. I have to comply to their pace.
And that's why, in some cases, as Brian just described it, it's important for you to take 4.5 hours to interview a patient just to get it right.
It is a kind of average time, yes.
Interesting stuff. Dwayne, do we need to take a break here? We've got another Brian, another a patient, a new patient. This will be an interesting one because here we just heard from a fellow who's been with the clinic for about 15 years or so and has clearly benefited from your hands-on approach, you and all the rest of the team, Dr. Philippe. But now we're going to take a quick break, and when we come back, we're going to meet someone who's just met you and find out what that's like. This is Boomer Life on CIL 650 with our friends from NeuroKinetics in the Highcroft building in downtown Vancouver at 3195 Granville Street, right there at 16th, just on the approach up the hill, and online at neurokinetics.com. Lots more still ahead after this.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650. We're back. This is Boomer Life on CIL 650.
It's all about the mind. It's all about the brain. Today on Boomer Life, our friends from NeuroKinetics are in studio in the persons of Dr. Philippe Souvestre, the founder of NeuroKinetics, along with clinic manager Sonia Dale, and J.C. Gordon, who's their liaison and logistics director, one of the new guys on the team. And one of the new patients at NeuroKinetics is Brian, who joins us from his home in the Kootenays. Brian, welcome to Boomer Life.
Hi, how's it going today?
Well, we're just fine, thank you. Very kind of you to make yourself available to us. Brian, you live and work up there in the Kootenays. You're in the mining business, and you had a rather traumatic event, an accident on the job a couple of years ago. Tell us a story, please.
I was training a new employee in one of the largest mining trucks in North America. And we were being loaded by the large $35 million shovel, and the shovel had a electrical malfunction and dropped the 125-ton bucket free-falled into the back of the mining truck I was in.
Oh, boy.
And so it bounced the front end of the truck 25 feet off the ground, and that's 1 million pounds.
Right.
So I didn't see it. There was no possible way to see the action coming to. So my body was limp, and I smashed my head on the window and tore all the muscles, basically from the bottom of my feet to the top of my head.
And were you hospitalized for a great deal of time after the accident?
I was only hospitalized for a day.
Wow.
But the pain, I was in extreme pain for over a year, of where I could barely even function.
Okay, and during that time, during your recuperation program, And obviously, this happened on the job. There would be all those workers' protocols that would be followed by your employer and all of that. So what sort of treatment packages were you presented with once you got out of the hospital? And I'm absolutely floored that you were only in the hospital for a day, but once you got out, clearly you were in a great deal of pain. So what did they offer you by way of treatment programs, Brian?
Nothing.
Really?
Yeah, not one thing. I had one doctor in Creston write a prescription for massage, and the massage, I was so extremely injured over the how a massage could help me.
Right.
That it helped a small amount, but I ended up going to gave up on the doctors in Canada and went to Idaho.
Oh, really?
Yeah. So I went to Idaho, and it helped out a little bit, but it was more chiropractic and physio and decompression.
Right.
And it just helped me for a short time.
Brian, were you receiving prescription medication during this process at all, or was that recommended? Was it recommended against that?
The way that the doctors in Canada treated me was to load me up on tramadol and other painkillers.
Right. Okay.
And excessive amounts, like 4 extra strength tramadols a day.
Oh my. Okay.
And I guess they figured that was the only treatment available. So I ended up spending $20,000 in the United States in about 3 months, and ran out of money. And then I was put on to the doctor in Vancouver at NeuroKinetics.
How did you find out about NeuroKinetics, Brian, up there in the Kootenays? I'm just curious.
My union found out about him.
Okay, all right.
And after going to NeuroKinetics and having them run their tests on me, I noticed an amazing change in just wearing their things that they put on my feet.
Interesting. So, what sort of testing had you? Well, I'm curious, and I'm looking for a comparison here. Given that you did see a number of doctors in both Canada and the United States, what's the testing procedures that you went through at NeuroKinetics, Brian? Were they similar to any you'd had before, or was this really new to you?
My doctor in Creston didn't even examine me. He just put me right on tramadol. And the doctors in the U.S. gave me a pretty detailed exam.
Right.
But the examination and tests that I had at NeuroKinetics was very extensive and very detailed, and what I would have expected before I had an accident, from anyone to do.
Right.
So they were incredible.
Okay, and so Brian, in addition to being, I assume that the pain is still there, given that you've just started with NeuroKinetics and there's a whole program of rehabilitation and therapy underway. But it sounds like already you're pretty confident that you're going to get better.
Absolutely. I could tell. That they were confident in their treatment plan, and also I noticed from the tests that they did run on me that I did feel quite a bit better with my balance and dizziness and my headache, and I know that their treatment plan could help me out tremendously.
In the process of going through those tests and having a conversation with Dr. Philippe, did you find out, was the doctor able to tell you to some extent what had happened to you and why you were feeling as messed up as you are and why you hurt so badly. Was there an explanation offered, Brian?
Yes, absolutely, and it really helped me, because when you go to doctors that don't know what they're doing,
right,
they make you feel like you're crazy.
Mm-hmm.
They make you feel like you're a crazy person, and it doesn't help you out a bit when all they do is sign you a prescription for tramadol and say, well, we'll see you in 3 weeks. That's no way to get better.
Right. So now you've had your first, Sonia's just nodding vigorously here because she's met you and she's put you through, is it assessment 1,
yes.
Sonia, of 3, right?
Level 1, yes.
Level 1
yes.
assessment. And so you're expecting Brian to return sometime soon?
Soon, yes.
For rounds 2 and 3.
Yes, that's correct.
So, Brian, you got to be looking forward to this. Hope, a big, bright light at the end of the tunnel. Finally, eh?
It's just like Christmas morning.
Well, I wish you considerable success with Dr. Philippe. I know you're in very capable hands, Brian. And thank you very much for joining us today on Boomer Life to give us a little background on your story. And thumbs up to you. Continued success.
Thank you very much.
Thank you, Brian.
Thanks, Brian.
Thank you.
Thank you, Brian.
There's Brian in the Kootenays in Creston this morning. Now he's just started with NeuroKinetics, but Dr. Philippe, another example of someone who got drugs. I went through this incredible. The description of what happened to him in that accident. Holy cow. You described our first guest, JC, as a walking miracle. Well, this guy's not too far behind. Holy cow.
We're getting in there, Sterling, absolutely. And what Brian was able to articulate so nicely is what our initial evaluation is able to do.
Right.
What we do at stage 1 with everybody is measure to what degree we're going to be able to help them, and even if we're going to be able to help them.
Sure,
And in Brian's case, he had just a glimpse, and when I mean a glimpse, I mean 2 or 3 minutes of what our potential is, and that 2 or 3 minutes was able to help him with his balance, help him with his headaches, and that's what we do. What Dr. Philippe was doing was optimizing the brain and see if he had the potential to have his brain optimized, which he was able to do.
Okay.
And that's always the first step with anybody new who calls us up. Excuse me, we're able to measure to determine if we are going to be able to help to optimize the brain.
Dr. Philippe, we got to take a break, but the suspense is killing me. Brian said he started to feel better after that first assessment and going through those tests that JC just talked about. He said you gave him something for his feet and it made him feel better almost immediately. What did you give him?
Our assessment methodology includes sensitization, as we call it, which means stimulating some brain controls, which are sensorimotor and cognitive for those who are interested in the details. And basically it boils down to assess the capability to respond and address any type of relevant stimulation that is specific to these particular controls.
Okay. So you were able to help him with his balance. By the sounds of it, that's a biggie for all of us, of course.
And the beauty of this expertise, which fascinated me over the past 3 decades, is that we have that capability to foresee how much again a patient can benefit from any relevant treatment program we have.
Right.
Before even initiating the treatment.
Right. And you were saying, JC, that part of the assessment process, and Sonia's described this to us in the past too, is that you find out how much this person can be helped. Have you ever run into someone whom you've had to say, I don't think I can help this person?
Yes, it does happen.
It does?
It does.
Interesting.
You know, I'm not God is probably a good thing.
It probably is. It probably is. But even then, I'm sure that it must have been a shocking moment for all, right?
It is tough.
Right.
But we are not without resource, even in these tragic cases, because we have an understanding of what happened on a detailed fashion, and to the extent nobody else has so far. And we are able to come up with directions, recommendations, and connect those patients with the relevant means to help them.
Right. And in this case of Brian, one meeting, he's been there only for a couple of hours, and already he knows or has a really strong sense, JC, of what's wrong with him. And again, that's empowering. If you have an understanding of what's going on, it makes it a whole lot easier to deal with already, doesn't it?
Absolutely. It turns on the hope light.
That's right.
In everybody, Sterling.
Okay. Our friends from NeuroKinetics with lots more on Boomer Life coming right up after this.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL. Sit back. This is Boomer Life on CIL 650.
With you on my mind. With you on my mind.
Wow, back to the 50s for that one. A little Nat King Cole with you on my mind. The mind is the subject of the conversation, as you can probably tell from all the musical clues that our producer, Dwayne Bishop, has been inserting into the program. Our friends from NeuroKinetics Clinic are with us here on Boomer Life today. Dr. Philippe Silvestre is the clinic founder. The manager is Sonia Dale, and J.C. Gordon is Director of Liaison and Logistics. We've also heard from a couple of patients in the program today. Really moving stuff from both Brian here in the Fraser Valley and another Brian joining us from up there in the Kootenays. Now, it's the second Brian, Sonia Dale, that I wanted to talk to you about, because he said he's only been to see Dr. Philippe once, and he's been there for the first of 3 assessment visits. In his case, about 3 hours. Is that a typical length?
Typical, yes.
Okay.
Yes.
And tell us a little bit about what happens in those 3 assessment. And everybody who comes to the clinic goes through the same procedures, right? Assessments 1, 2, and 3, and then and only then does a treatment program begin, correct?
That is correct, yes.
Okay, so tell us about the assessments.
The assessments, level 1, begins off with, they're usually the same pattern, but more and more testing gets added on to level 2 and level 3.
Okay.
So what happens is usually anywhere between 45 minutes to an hour, I would say, for each level of assessment, time is taken to go through a thorough medical history review.
Okay.
As soon as they do come in and see us, we ask them to, start a journal pretty much from the consultation stage, and we know they're going to go ahead and move forward with us to a level.
And when people come in for the first time, what documentation, if any, do you request that they bring along with them, Sonia?
We ask them everything. So all medical history review, whether it's, x-rays, whether it's MRI documents. If they don't have that documentation, but they know where they've, got the information from, or they did the testing
they'll know where it's filed.
Exactly. We just ask for the authorization, and I'll go ahead, or our staff will go ahead and get that information.
Also, very quickly, is it helpful if they show up with a friend with them, a companion of some kind?
I would say yes, but a supportive friend.
Okay.
Meaning someone who clearly understands them and their condition.
Okay.
Having maybe not the correct person who doesn't understand their symptoms and their condition may not also be a good thing.
Right.
Someone who mainly is a part of their life, I would say day to day or on a weekly basis, they can see, yes, this is how they've changed throughout the week or 2 weeks or a year to 2 years.
Okay.
That would be, yes, ideally a good thing to do.
So Brian described his first session as being a series of tests, which you've also said happens.
Yes.
And you also said those tests are repeated in the second and third assessments. And Dr. Philippe said during the break that, yes, they do get repeated, but they become more complex as the assessments go forward. Again, this is the procedure, Dr. Philippe, that you use. You have a method, and that this repeating tests and making them more complex is part of the method, right?
Totally.
Interesting. So, Sonia, after how many sessions is Dr. Philippe and the team ready to begin to formulate a plan, an action plan?
After the level 3 third assessment.
Okay.
We need the objective data from all 3 assessments in order for us to go ahead and make the customized treatment program.
Okay.
We can find that the data collected, or measurable data collected from level 1 will differ from level 2, but it also could be that in level 3 we get a completely different result. That's why we need all 3 of them to go ahead and make their customized treatment program.
And if I could summarize that a little bit as well, is that it takes 3 sessions to determine a pattern. For example, if a person just had 2 and moved from number 1 to number 3, you're not really sure if it's going to go from number 1 to 3 to 8 or from number 1 to 3 to 4 or 5. So that's why we need the 3 to determine the pattern of where the brain is basically at.
And I've said that before in other shows as well. It's also comparing, you can trick your brain once
right.
to repeat and do something again, so which is going to be our level 2 assessment. But the third time, eventually, if you're not well, you can't, play that trick again.
How much time do you recommend between the visits, between first, second, and third assessments? They don't go day after day after day, do they? They can?
They do, yes.
Oh, my.
We do recommend that. It's just we recommend to have them day after day after day, and then we would like to go ahead and start the treatment process. That way we know where the brain is at, what we're working with, what the condition is at. Too much gap in between is not a very good thing.
JC, one thing that has come up in this discussion many times is NeuroKinetics is a private clinic. Therefore, I assume from that description that a physician's referral is not required. Anyone can call the clinic and make an appointment.
That's correct. As a private clinic, anybody can, and that happens on a regular basis.
Okay. So if you'd like some information on NeuroKinetics, for example, the phone number and the email, it's info@neurokinetics.com. That gets right to you, too, doesn't it, Sonia?
Yes, it does.
Okay. And the website, by the way, is neurokinetics.com. All the phone numbers for all of the team members, including JC and Sonia and, of course, Dr. Philippe, and the address. There's even a map, for crying out loud, at neurokinetics.com. Thank you all three for jumping in on Boomer Life. A fascinating discussion. Great guests. Thank you for providing those as well.
Thank you, Sterling.
We'll see you next time.
Bye-bye.
Bye now.